Hey, Coach Adam here. I'm the Certified Strength and Conditioning Specialist and Nutritionist for the Schriever Guardian Resilience Team. This first module is going to cover the MOVE category within the 5 factors of health. By the end of this class in particular, we have 2 primary learning objectives. For our 2 primary learning objectives, we have hopefully that you will be able to identify the vast benefits of physical activity for improvements in not only your physical performance, but also your mental health and longevity. Our second learning objective is that you, the learner, will be able to implement the lessons learned in this class by increasing your non-exercise activity thermogenesis, or NEAT, as well as your daily step count, your daily movement overall, and exercise across broad time, modal, and planar demands. And that kind of ties into what we covered with Health in 100 Words, how Coach Jason started off this entire classroom, which is our MOVE sentences within Health in 100 Words. As you can see, aim for improved work capacity across broad time and modal demands, and then exercise through all planes of movement in full ranges of motion. We'll talk about that slide again at the end after we go over the frameworks for kind of how to think about movement, which is the whole intention of what this first course is going to be within this module. Within this module, we'll have 4 main courses. This is our movement overview course. Then we'll have a resistance training course, one on conditioning training, and then a final one on movement optimization. This course in class in specifics will hopefully give you a framework for how to think about movement in general. So we should first start by just talking about the benefits of physical activity. The benefits of physical activity are absolutely vast. And so some of the ones we want to prioritize is just the fact that there's an entire movement within what's called the American College of Sports Medicine, the ACSM, that's called Exercise is Medicine. If you want to go into that reference, you certainly can. But according to the ACSM, the goal of exercise as medicine as a sort of concept is to make physical activity and exercise part of standard disease prevention and treatment for all patients. And the reason why that's a sort of line of effort is because there is just irrefutable evidence that physical activity has tremendous benefits for all aspects of our health and wellness, right? Physical activity can decrease the risk of cardiovascular disease, diabetes, cancer, hypertension, obesity, depression, anxiety, suicide, and premature death, to name a few. This is why we think physical activity is the first one, and the priority is because by getting daily physical movement, it can kind of function as what we call a keystone habit to spur you to make other fantastic decisions. For example, if I start a movement habit or a movement routine, a lot of times it helps people get motivated to eat healthier. And it also improves our sleep quality. It also can improve the way that we think about ourselves or our overall general motivation, right? And so that's kind of why we start with physical activity as our first course within this classroom. Now, finally, physical activity also can improve strength and aerobic benefits, and those improvements, of course, being in the military setting, improve your occupational performance. So being a fitter or generally healthier version of yourself, someone who gets regular physical activity on a daily and weekly basis, actually improves your occupational performance. So your daily acts of living or your daily job tasks, you will be better off. Even if those are primarily cognitive in nature, you will be or function better if you are a healthier version of yourself who gets physical activity. So next is just essentially daily movement. For daily movement, this is the kind of core concept for what we want you to understand about physical activity and movement within this category is essentially all movement matters, right? I talked about that term non-exercise activity thermogenesis, or the acronym is NEAT, N-E-A-T. All movement makes a difference. So NEAT makes up a pretty large proportion or percentage of our total daily caloric expenditure. We essentially move a decent bit. A lot of times people that fidget can burn a couple extra calories on a daily basis, or by just taking the stairs or parking far away deliberately, or taking your dog for 2 laps of that walk you do every evening instead of 1 lap can dramatically increase your physical activity and caloric expenditure. That ties in directly to our daily step count. There's a lot of research literature demonstrating the impactful nature of what your step count and increasing your daily step count can do for your overall health and wellness. For example, research has shown that 8,000 steps daily can dramatically increase your health and wellness and absolutely decrease your risk for all-cause and cardiovascular mortality. Being that the number one risk factor for early death is cardiovascular disease in America, well, if we can dramatically decrease all-cause mortality and specifically cardiovascular mortality, well, that is a net positive, of course. What is interesting is it doesn't even have to be 8,000 steps on a daily basis, although I do, of course, recommend that you get that more frequently than not. Even getting 1 or 2 days a week of 8,000 steps a day can also significantly decrease your risk for all-cause and cardiovascular mortality, which I think is a really impactful thing to note. Even if you say, hey, I'm working the night shift and I have a hard time getting physical activity when I'm on the night shift. Even if you seek for those off days that you may have on your calendar to get 8,000 or more steps on that day, you can still decrease your risk for different disease states. And that does go to show, again, the importance of general physical activity and your daily step count. Now, we talked about this a bit in Health in 100 Words, but access full ranges of motion, right? We say exercising through full ranges of motion. We'll kind of talk about what that is. So there's a difference between flexibility, mobility, and ownership. When we think about flexibility, it's sort of your tissue's ability to kind of stretch or elongate in alignment with what you're asking your body to do. Mobility is more of sort of owning your ability to move through that range of motion and also do that safely and be able to produce force in that range of motion. So if I go through a full depth squat or if I stretch my hamstrings all the way down and try to touch my toes, but I essentially am at risk of getting hurt down there, well, I'm probably not very mobile. Similarly, if I'm doing a compound movement, let's say like a push-up or a pull-up, and I experience shoulder pain because I can't actually generate force in a full range of motion with my arms overhead, well, that's not very mobile, right? We want to have flexibility and mobility and a good relationship between the two. And then that's where we come to ownership. So owning that range of motion, owning full range of motion for what that means for you is kind of where we get to everyone is different. Your body is built different. We have different, it's called anthropometry. Our body's built different. And so maybe my squat pattern is going to look a little different than what yours might look like. And that's totally fine. What we care more about is the fact that based off how your body is built, we want you to be able to move through all those accessible ranges of motion at the shoulder, at the wrist, at the elbow, at the knee, the hip, the ankle, and so on, so that you always have the ability to move through those ranges of motion and have ownership and not think that you're going to get hurt anytime you go through that range of motion. Because, as most of us are probably familiar, we have that use it or lose it principle. If I don't use the plane of movement or if I don't use a full range of motion, my body's going to start to think, oh, well, I probably don't need that thing. And it's going to start to tighten up a little bit more than maybe what we would like it to do. That's where we get into what are our planes of movement. So with our planes of movement, we kind of have 3 planes of movement. So our first one is just this forward and back plane of movement. Moving forward and back, doing something, let's say like an air squat or even a lunge, for example. That is our front back plane of movement, which is referred to as the sagittal plane. Our next one is our frontal plane, which is sort of a side-to-side, type of movement. So doing agility shuttles, with shuffles back and forth. You could also do like a lateral lunge movement or a side raise, a lateral raise out to the sides. That is also in the frontal plane of movement. And then the final one is our sort of twisting or transverse plane of movement, right? So doing things like a golf swing or swinging a baseball bat or throwing a baseball or, plenty of other sport demands, but as well as things in the gym, such as, twisting a cable and doing chopping movements or swinging a sledgehammer against a tire. Those types of things are in that transverse or twisting plane of movement. Now, it's important to understand these planes of movement because whenever we have Health in 100 Words, if, again, we don't use it, we run the risk of losing it, which is, of course, the opposite of what we want. And so we need to put our body through not just sagittal plane of movement, like walking or squatting or doing general daily tasks. We definitely need to introduce or keep in there, as long as we can, frontal plane of movement and transverse or twisting planes of movement exercises in our daily physical activity. Because if we don't, we again run the risk of increasing the injury likelihood because we're just not used to that movement pattern. And that's not what we want. Now, I've talked a lot about movement patterns. We sort of categorize our movement patterns into the different movements or ability of our body to move through different exercises, right? So we have general classifications or categories for exercise for how you can think about what exercises you need to include so that you can prevent, hopefully, losing that ability. So our 10 primary fundamental movement patterns include the squat movement, right, which is just squatting down with open hips. We have a deadlift or a hinging movement pattern, which is the knees staying somewhat stable and hinging at the hips forward and back or picking something up off the ground. Our next one is a horizontal pressing movement, such as pressing yourself up off the ground like a burpee or a push-up or a bench press. Our next one is our vertical pressing movement, right? Getting a suitcase overhead compartment in an airplane, right? Or doing a shoulder press at the gym. Our fifth one is a horizontal pulling movement, let's say like starting a lawnmower or doing a row pattern in the gym. Our sixth one is a vertical pulling movement, such as doing a pull down or pulling something down off the top shelf and then lowering it down slowly, as well as pulling things from overhead down to you. The seventh one is a lunge movement pattern where we have a split foot and we get into this split position and lunge in some way. So such as even taking the stairs or going for a hike, we can see sort of a lunge movement pattern where my feet are split and I still need to have access to that fundamental movement pattern. Our next one is a rotational or anti-rotational pattern. So doing things like a golf swing or swinging a baseball bat or throwing a pitch in baseball. Those types of things are rotational movements, but we also have anti-rotation. Let's say like, holding on for dear life on the back of a boat while you're tubing, and things like that, right? Where I'm purposely not trying to rotate. I'm purposely trying to lock myself in and prevent rotation of my torso and hips. Our next one is monostructural movement. So monostructural movements are sort of things like our conditioning movements, like running, rowing, swimming, cycling, those types of things are our monostructural patterns. And then our final one is odd object work. Things like carrying sandbags, flipping tires, swinging a sledgehammer, doing those types of things, carries, sleds, those types of things, is sort of our odd object work, where we still have the ability to kind of just do work, right? Which is what we kind of get at in Health in 100 Words with improving your work capacity. Again, as I said before, your body is built to move, but if you don't use it, you run the risk of losing it. Now, for our final notes, we have some key things that I haven't gone over yet that I think is important to note. You need to aim for more than just the minimum recommended physical activity on a weekly basis. Now, according to the World Health Organization and the United States Physical Activity Group, those guidelines recommend at least weekly physical activity of 150 to 300 minutes of moderate or 75 to 150 minutes of vigorous physical activity on a weekly basis. Now, what's important to note is there's a combination there. So if I get, let's say, 75 minutes of vigorous, that would count as 150 minutes of moderate according to these guidelines. So you could have 150 minutes of moderate with 75 minutes of vigorous, and that would be a combined 300 total physical activity minutes because you get sort of twice the minutes per minute spent in that heart rate range for vigorous activity. But what's very important to note is those specifically say at least. That's not sort of the threshold for where all the health benefits are met. You can continue to achieve additional physical health benefits as well as performance benefits by increasing your physical activity even higher within your tolerance range. So while minimum induces general health benefits, much more is needed to maximize your longevity and performance. For example, this study has shown that maximal longevity gains is roughly 700 minutes of moderate or 350 minutes of vigorous physical activity on a weekly basis. Again, it's a combination just like the other one, but what's important to note is that's dang near double, a little higher than double what's recommended on the upper end of that range by the WHO and the PAG. So the reason why that's important is to note that just because you've met the minimum threshold doesn't mean that there's still not additional benefits that you can get if you exercise a little bit above the minimum recommendations. Now, of course, that goes into what we'll talk about in the future with the Recover module and the Movement Optimization module, where we'll talk a little further about what it means to fully recover and what it means to prevent overtraining and, essentially non-functional sort of physical activity where it's not beneficial to you. But generally speaking, getting a little higher physical activity would be a better thing for you. Now, we'll reflect back on Health in 100 Words. Hopefully you now, after this framework presentation, better understand what we say when we say improved work capacity across broad time and modal demands. So, for example, work capacity is just your ability to do work. Broad time means I can sprint for a second, I can maximally jump as far as I can, but I can also, carry my 2-year-old around Disney World for 5 hours. Well, that's broad time, right? I also have different modal demands. We talked about those fundamental movement patterns. A lot of those are different modalities of exercise. So hopefully you introduce yourself to different types of movement demands, such as running, swimming, rowing, or also resistance training movements, such as the different ones that we covered earlier in this class. Then for exercise through all planes of movement in full ranges of motion, essentially we went over our planes of movement, what those 3 planes of movement are, and how you should definitely prioritize getting access or incorporating movements that go through all 3 of those planes in your weekly physical activity plans. And then finally, full ranges of motion. We understand what that means, right? Access the ownership of that range of motion, expose your body to that demand so it doesn't lose the capacity and ability to do that movement in the first place. These are some of the references we used for this presentation, and I will see you in the next class, which is for the resistance training.